so this is
Good morning.
Rita. Good morning. Rita has been my patient for quite some time, 10 years for neck pain and back pain, and she recently developed shoulder pain. Right now, we treated her once with PRP. I offered her the PRP. We used to do cortisone in the old days for her, and that's helped her quite a bit. But since our direction went down into a PRP and promoting the healing process, we switched her to a PRP. So she's done one treatment, and today is her second treatment, right? So I'm just gonna review with her what the issues are. So she's got some arthritis in the joint, wear and tear, and she's got tendinosis and tendinopathy in 3 of her muscles, the subscapularis, supraspinatus, and the biceps. So the biceps tendon is a little inflamed, it just wear and tear. And the supraspinatus and suprascapularis are muscles that help us provide some movement from 0 to 15 degrees. That's why she's having the difficulty and the pain. So we're gonna do in her left shoulder today, PRP, platelet-rich plasma. We take your blood, we spin it, and we inject it, right? Okay. And we're gonna do 2 actually procedures today. We're gonna do the regular PRP. Usually we yield more than 1 million cells, and then we're gonna do a filtered one. So we take all the cells out, because the recent study showed that it will cause inflammation into the joint. And this is what we use now. We use filtered, remove all the cells that can cause inflammation, and inject it into the joint for arthritis. That will line the joint and heal it back and slow down the arthritis, and in some cases, it will reverse the arthritis as well. Sounds good? You ready?
Sounds good. Yes,
Okay.
I'm ready. Thank you.
So we've done cortisone before.
Yes.
And you get some relief.
Some relief.
What's the difference between the cortisone and the PRP that we've
With the
done last time?
PRP, I was able to move my arm much more higher. Lasted about 3 weeks. With the cortisone, I felt it didn't last as long because it's the PRP and it's helped me.
You weren't able to sleep on that side.
No, not at all.
Now
Not
it's
at
much
all.
better.
Yeah, it's much better.
Okay, so hopefully you'll get better results with the second PRP. We usually recommend 3 treatments with PRP just for a complete recovery from tendonitis and tendinosis. We'll check with Rita in a month to see how she's going to do after the second treatment.
Okay, that'd be good.
All right, so this is the liquid gold, the PRP, and this is filtered. So we removed all the cells that can cause inflammation inside the joint. The whole idea from this is to reduce inflammation and reduce the arthritis, and hopefully we reverse the arthritis back to a normal joint. I have here Golnaz, our ultrasonographer. She's our secret weapon. She worked with athletes and celebrities and all over the country. And she's helping me today with the injection.
So Rita has some degenerative changes in her posterior joint, and we can see there's a bulging of the capsule, and X-ray showed confirmed moderate osteoarthritis in the joint. We are taking a posterior approach, and Dr. Demian will be going ahead with the injection. So yeah, we can go ahead.
All right. We just did 3 cc of filtered platelet-rich plasma activated into the joint itself, right? You don't need more than that to actually fix or help the arthritis and treat the joint. What we're doing now is a full PRP, including all the cells, including the activated cells, into the tendons to treat tendonitis, tendinopathy, or any inflammation. Again, you have to be very precise where the inflammation is. Otherwise, you wouldn't be able to get the results that you want.
Ultrasound guided procedures are really helpful. They are not only safe, they are effective, and precision measures really. If they are not precise enough, we won't be able to achieve our results. A lot of doctors are doing, but they have to be sure that they are targeting the right pathology and to the right area. And only I find that making them more targeted and precise makes them more effective. And with ultrasound, you can easily avoid nerves and vessels, so it's a safer approach. I think blind injections should no longer be done. It all should be ultrasound guided. So she has a small area where there is tendinosis and some micro tearing in her supraspinatus tendon. So we will be targeting PRP on this spot. So Dr. Demian is going to be going ahead with the injection.
Yep. How you doing?
Good.
Good.
Thank you.
PRP is different than any other injection. It's a living cell. And to do that, we have really to respect it. So we usually advise the patient a few things before and a few things after. Before, we advise the patient to cut down into alcohol drinking, any non-steroidal anti-inflammatory, any blood thinners should be stopped, and most supplements, whatever it's multivitamins or whatnot, should be stopped as well 5 days before the procedure. After the procedure, the patient should continue with the same, but avoid soaking in water, swimming, or bathing at all costs, because it's still an open wound, and we have to respect that so it wouldn't get infected. The patient can take Tylenol for the pain. As you can see, it's a very tolerable procedure, and the patient usually after a couple of hours have no pain at all. You will feel like somebody really punched you hard in the shoulder for a couple of hours, and after that it's gone. It's exactly like a bruise, I would say, but after that the pain is really very tolerable, way easier actually than a cortisone injection or any other injection.